okay, you're in the emerge. Coming in by ambulance does not get you in any faster. No matter how you get there, you deal with triage. Love triage. This is usually an experienced, nasty person, evil to the core, who gains points by the amount of misery and suffering they can inflict. Second only to me in their joy of inflicting pain. Now, I'm obviously kidding. You want your triage person to be the most well-trained and the most sophisticated, because they're making life and death decisions right there. Triage nurse's job, very simple. She looks at you. She decides based on a certain set of questions that they're trained to ask, and your vital signs, your temperature, your blood pressure, your pulse, your oxygen saturation in your blood that they take by that little thing they clamp on your finger that's looking at oxygen inside your bloodstream. And she looks at your complaint, and she says, priority 1, they need to go in immediately or they're going to die in a few seconds. Priority 5, so they'll wait 3 days in the emergency room. You know? And that's the reality. I'm not set up for these things. I'm really set up for acute things. I do really good job if you come in, God forbid, with a stroke. You get to me in enough time, and it's appropriate. I have a code stroke called. I get you to CT scan. I make certain there isn't a clot or something, what's going on inside your brain. I get neurology there within seconds. And if you're a candidate for breaking open that clot, I can do that. I'm really good at that. God forbid you come in with a heart attack, I'm the place to do that. But you come in with, I've had tummy pain for 16 weeks, and I've been investigated by 15 doctors, I'm not the greatest place for this. Let's be honest. Right? I'm not going to give you such insight that someone else before me who's a lot smarter than I am hasn't come up with. Okay, so triage happens. I want to tell you, though, about a few important things about triage. Your status can change while you're waiting. If something should change, don't count on the nurse to know it. Please notify the nurse if something, or if it seems like you've been forgotten. As long as you do it politely, no nurse will snap off your head. I've been here for 6 hours. Don't give the old, they've all passed in ahead of me. You have no idea what's going on or why they've moved in ahead of you. But do say, I've been here for 6 hours. I did step out. Is there a possibility you might have called my name while I was out? I'd be very hurt if I missed out on my, something like that. No one's going to scream at you about. Or, I wasn't having chest pain before, but now I am. Something has changed. That's legitimate. Also, if you're going to go pee or do something, she may want that sample. So before you go to pee, poo, do whatever you're going to do, you might want to go to the nurse and say, do you think they'll need a urine sample? I have to go to the bathroom anyway right now. Hey, it may make the process a lot faster. See what I'm going at here? So triage is you, whether you come in by ambulance, whether you come in walking, and they make their big decision. By the way, you want to get in quickly? I'm having crushing retrosternal chest pain, and I can't breathe, and my doctors told me this is a heart attack. We'll catch on very quickly, but if you want to go for it, what the heck? You get one free kick at the can, and then, I warn you, though, you come back with the real thing next time, Anyway, so that's triage, and then you get sent in. And then you sit. Let's say you're really sick. Let's say you've come in with crushing retrosternal chest pain. They move you into the front, the monitors, the blood, the intravenous, the thing's going beep, 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 beep. And you say, thank God I'm alive. I can still hear the beep, 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 beep. Good sign. And then you sit. And you wonder, what the heck is going on here? They put me in a bed, and they forgot about me. What you realize is a lot has already happened. An awful lot has already happened. The bloods have gone off. I need those initial bloods anyway, in spite of whatever I find. You've probably had that electrocardiogram done by the technician. The nurse has looked at it. If there's something evil going on and you need to be seen, at least in my emergency room, I'm fairly comfortable that the nurses will get me if they need me, no matter what else I'm doing. And I will check from time to time with my head nurse. The lady that you just brought into square 3, it says chest pain. How is she? She says, don't worry about it, Mitch. We have to work her up. She can wait a few minutes while you do other things. So you're in the best place, God forbid, because you're being monitored. Anything goes wrong, the alarms go off. In fact, they usually go off when nothing is going wrong. So I'm sure they will, at least I hope they will go off when something is really going wrong. Okay.
So you're waiting there. And then usually, if you go to a McGill teaching hospital, there's some little pipsqueak who looks to be too young to even be your grandchild who comes in, right? Thank you. That's right. And so this is the, if you're lucky, a resident, you should only be so lucky, or it's maybe the medical students, and they all go, excuse me? Who are you to be coming to talk to me, a real patient? You can't realize how lucky you are. You can't realize. You see me, I'm going to ask 5 or 6 questions, examine you very quickly, and then go on to the next one, because I've seen it all, and I'm just looking for certain basic things. You want real care, someone who really cares about what's going on and is going to spend the time. You want that student or the resident. They'll spend the 15 hours, and so your grandchild had what? My God. Well, maybe it's related. They'll do this. And they'll spend the time. Luckily, under the supervision of the nurses, we're saying, is this going on a little bit too long? Or me, who has to worry about the flow of patients to my department. So what'll happen is the student or the resident will see them, and you're actually very lucky. And in fact, let's be honest, the resident is usually very hot, has just graduated, knows everything, stuff that I can't even spell, right? And then they will come and present to me, and they will tell me the story as they've constructed it from the information that you've given to them. And that's really important. Then I will go with them to the bedside sometimes to clarify. Now, people get really pissed off. They get pissed off for 2 reasons. I can say pissed off on video, can't I? If not, you'll have to edit it. They get bothered by one of 2 reasons. One, I already told my history to this doctor. Why are you asking me the same questions? Right? That's the one answer. The one question. Or the other question is, you only came for 3 seconds? What about all the time and all the stories that I have to tell you and everything else that's going on? In either case, I'm telling you not to worry. I'm asking you the same questions because you'd be surprised how answers change and become extremely illuminating the more times you ask them.
At the granular information, the little textures that I pick up that are so important. So yes, the nurses will ask it over and over again. The specialist will ask it over again. I'll ask it over and again. Don't be put off by that. We're not as stupid as we appear. Most of us. Some yes, most of us no. The other thing is you're going to say, well, why is he being so curt and so short with me? And it's not that I don't like you. That may be true, but that's not why I'm doing this. I'm this curt and short basically because there are very specific things I'm now looking for. I want to make certain when the resident told me your story, certain things were in kind of, and I want to be very, so I'm going to ask very pointed, very specific, very pushy questions. You say you had chest pain. What were you doing when you were doing that, when you were getting that chest pain? How long did it last? Very, very pointed, very, very specific, because I'm looking for those fine details that make a difference in terms of how I'm going to manage you. And then, of course, we then disappear. And you're left there in the cold, in that Johnny shirt, never with a pillow, God forbid, or a blanket, wondering, they came, they saw, have I been conquered? So you wait. Now again, time is the single most valuable resource I have on my hands. Oftentimes when someone is coming in with a heart attack or the signs of a heart attack, 25% of the time the electrocardiogram may be completely normal. Their physical exam may not reveal anything. But if I do a baseline blood test then, and then repeat it 8 to 10 hours later, I'll pick it up. So a lot of times I'm deliberately taking my time because I want to keep you around to see what's happening. That evolution over time is probably the single most important thing I have to determine if something serious is going on or it isn't. So people I can move out quickly, I do. If I have any doubt, I'm keeping you under observation, although I don't call it that. I'm watching to see what happens. Now people often ask me, it's a good place to go into a totally different area, what should I bring to the emergency room with me? Your body is usually a handy thing, but you wouldn't be there if your body wasn't there too. So this is something we can forget about. What I tell people to bring is only what they can afford to lose or get broken. You don't need your dentures. I don't care what you look like. You don't need the makeup. You want to bring your glasses, you can see my ugly punim, feel free. But things like that you don't need, that you can't afford to have broken, God forbid, don't bring them with you to the emergency room. Same thing about jewelry, about valuables, about cash. What are you going to spend the money on? Bring zip, squat. As it is, we're probably going to lose your Medicare card, right? But you got to bring it. Limit the amount of stuff you're going to lose. So that's number one thing. Only bring what you really need. Please, please, bring me a list of your medicines. I love it when they say, I'm taking pills for my heart. Thank you. Which pills? It's a little white one. Do you know how many little white pills there are? It's impossible. Or better yet, they put all their pills in the single pill bottle. Beautiful color-wise, useless in terms of trying to figure out what's going on. Now, I don't expect you guys to know what pills you're on to keep a little, but it's really easy now. You go to the pharmacy, you tell the pharmacist, please print out a list of my medicines, you fold the list, you stick it with your Medicare card. I'm telling you right now, if Urgence Santé looks for nothing else, they'll look for your Medicare card. If you stick it with your Medicare card, I get it. Don't count on the fact that you've been a patient at the Vic for the last 50 years. Our very sophisticated 21st century system means that sometimes I get a paper chart from 1922 without your most recent visits. This is the reality. So I may not get your chart, it may not be complete. Don't count on that. Bring your list of medications. Please, if you have allergies, it's nice to know them, or write them down there. And the other thing many of you will have, or many people will have, is a recent summary of their discharge from the hospital. It's like gold for me. Patient just left a month ago. This is why they were there. All the things that were done, the medications they were discharged with. My goodness, what a difference that makes. Oh, gee, you know, my life has suddenly become 1,000-fold simpler. And if my life is easier, let's be honest, your life is easier too, right? You want to make my life as easy as possible, so your life is as easy as possible. By the way, if you're traveling, it's always a good idea to carry a list of your medications with what we call the chemical name rather than the brand name, because the name may change in different countries for no real reason, just to confuse people. A copy of a recent electrocardiogram, a copy of, you know, anything, take it with you. And if you're traveling, never put your drugs in your baggage. Keep it with you. Mitch, we know this stuff. Okay, okay. Just never hurts to repeat this stuff. Okay. So, we talked about what you should take. There's another really important thing you need to take with you in the emergency room, and this is a friend. Why? The reality is, if you turn up in my emergency room and you're put in some corridor, my staff is really kind of busy. And God forbid you should need help to go to the bathroom, they may not really view you as a priority. You need an advocate. You need someone who's going to get a nurse if you need a nurse, get me if you need me, or help you to the bathroom. It doesn't even have to be someone you like. In fact, perhaps it's better it's someone you don't like, so you can inflict this on them. This is your choice. A child who's never visiting, this may be the thing that you want to do to them. But the idea being that you need an advocate with you, and also you need an advocate because if you're sick, it's tough to concentrate on everything that's going on, and the doctor may tell you stuff, and I've had this happen even to myself. Doctor told me, thank you, doctor told me something. This is what I'm getting paid for this. I hope it's good. I hope it's at least good quality. Now you made me lose my train of thought. This is an evil thing to do. Exactly. So like me, you're being told something you can't remember. What the heck was he saying? What was he talking about, right? So you want someone there who's not as farmished as you are, right? You're sick, you're allowed to be out of it. You want someone who's going to pay attention, can maybe ask the questions that you really won't think of because you're just so overwhelmed by what's happening, and also will retain the information later. Very, very important. Remember, once you're in the emergency room, that part of what's going to happen is the natural delay of the sequence of events that it takes for things to happen, and delay is usually on your side. If something changes or something is wrong, let someone know. Don't count on the fact that they're aware of what's going on. Okay.